Good afternoon. Welcome back to Facebook Live here on the Oneida Nation Reservation in Wisconsin. Today's Tuesday, December 9th, and I'm Bobby Webster. I'm the PR Director for the Oneida Nation. We've got a bevy of guests here today, and to start off our update from the Comprehensive Community Health Center, we have Paige Dworak, who's the epidemiologist, and we also have back with us Mary Kreischer, who's the Director of Behavioral Health. So we're going to start off with our first two guests, and then we are going to welcome Sherry Forget and Carrie Blahowiak, and they have some more information that they're going to share with us. So without any further delay, Paige.
Awesome.
Update.
Thank you for having us, Bobby. So we're here today to talk about the social determinant of health, which are commonly referred to as SDOH, but these are the non-medical factors that influence health outcomes. SDOH are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. These factors can include access to childcare, access to safe and affordable housing, access to healthy foods, access to transportation, personal safety, and financial strain, among other factors.
Thank you, Paige. Addressing the patient's social determinants of health needs can enhance health and lead to better outcomes. Therefore, the Oneida Comprehensive Health Division is committed in conducting this screening with patients as it aligns with our mission in providing the highest quality holistic health care to ensure the wellness of our Oneida community. Behavioral Health has been conducting these screenings for a while now, and the medical clinic has implemented the screenings as part of the adult physical exams. The results are confidential, and it will be reviewed by your care team. Your care team will connect you with resources in the community to their best of their ability. The screening will be available to fill out on the patient portal prior to your arrival. Our goal is to gain a deeper understanding of factors that influence our community's overall health and well-being.
Thanks, Mary. In addition to providing resources and referrals for patients with identified social needs, like Mary mentioned, there are several ways that OCHD is committed to using the data that's gathered from the social determinant of health screening to improve health and wellness of the entire Oneida community. So one example is within the Oneida Community Health Improvement Plan. So there's a work group that's using the SDOH data to identify transportation needs, barriers, and opportunities for improvement in the community. So this work group is consisting of various partners from within the Oneida organization that are all dedicated to improving transportation needs in the community.
We thank you for taking the time to fill out the social determinants of health questionnaire at your next appointment.
Thank you, ladies. And while we wait for Sherry and Carrie to come up, I do have a little bit of an announcement. We do have a weather advisory that we've had issued today. And due to the impending storm that has been forecasted on all of our local stations, the Oneida Nation will have a 10 a.m. delayed start tomorrow, Wednesday, December 10th. Start time will be 10 a.m. for all of our programs and offices here. Please do not come in before 10 because we need DPW and our crews to clear the lots effectively. And if there are cars scattered throughout the lots, it makes it more difficult for them to do an efficient job. So again, 10 a.m. delayed start. Please allow our ground crews and our plows adequate time to do the walkways and the lots. So now we have Carrie Blahowiak and Sherry Forget. So Sherry's going to start off with giving us an update on the things in her area.
Thank you. So in addition to discussing the social determinants of the health screening, we wanted to let the community know that we received a successful accreditation at the OCHD in September. The Oneida Community Health Division welcomed 2 surveyors from the Accreditation Association for Ambulatory Health Care, which is called AAHC, to spend 2 days in our facilities. The surveyors come every 3 years and have set standards that they review to ensure that we're providing the best quality care that we can to our patients. Out of hundreds of standards, the health division had 0 deficiencies. So this was our third time completing this successful accreditation, and we look forward to seeing them again in 2028. Go ahead, Karen.
Thanks, Sherry. I would like to share some great news for our laboratory at the Oneida Health Center. On November 19th, we at the Oneida Community Health Center successfully passed its federal certification inspection. This review for the laboratory is called a CLIA survey, and it happens every 2 years, and it makes sure that we meet the highest standards for quality and safety. So what is CLIA? It stands for Clinical Laboratory Improvement Amendments. It's a U.S. law that regulates laboratory testing on human samples to make sure results are accurate and reliable. In other words, it's what keeps your test results trustworthy. The inspection team that joined us was from the Wisconsin Department of Health Services and the Centers for Medicare and Medicaid Services. They praised our lab for the commitment we have to excellence. They were impressed by our accuracy of testing and the wide variety of tests we offer right here in the community. Our lab team is made up of highly trained professionals. Each of us is board certified by the American Society of Clinical Pathologists. We work hard every day to provide exceptional diagnostic services that will help keep our community healthy. And we would like to thank you for trusting us with your care. We're proud to serve you and deliver top quality laboratory services right here at the Oneida Health Center. Thank you.
And in closing, we just wanted to remind you that the Health Center Division, with exception of the AJR CCC, will be closed per the nation's holiday observance calendar. This includes closing at noon on December 24th and all day on Christmas, the 25th. And again, all day on New Year's, which is January 1st, so please make sure that you get your medications refilled.
And you are open New Year's Eve.
We are open New Year's Eve.
Yeah, we're all open New Year's Eve and closed on New Year's Day. But half a day on Christmas Eve.
Yes.
All right. Well, congratulations on your accreditation. That's great news. Just goes to show the great job that your team is doing over there. Thank you very much for all that work. We also want to say congratulations to our General Tribal Council. We have a new budget for the fiscal year 25-26. Last night, we had over 2,000 Oneida Nation citizens pass the budget. And next week on Oneida Live, we have the Oneida Singers coming in. So on Thursday, if you'd like to tune in and see the Oneida Singers who sing hymn songs for a long, long time, so we're going to welcome them here, as well as we have the Veteran Affairs Director, Connis Christel, and we also have John Danforth from the Oneida Trust and Enrollment Department coming in next week. Thursday, we will be welcoming Sean Paulus from our economic support area. And in closing, we just want to say to be careful. We've got an impending storm coming up, and we know people, it's early in the winter yet, so driving is a little taken for granted sometimes. Let's be careful out there. Drive slow and cautious and plan ahead. Takes a little bit extra time. And we just want to let you know that in February on Valentine's Day, there will be a winter gathering powwow at the Oneida Hotel. So that's February 14th, the winter gathering, and that's an event that's open to the community. It's free of charge, and it's always an awesome event at the hotel. With that, be safe, be careful, and have a good day. Nugiwa.